Antibiotics are produced by microorganisms which at high dilution are used to destroy or stop the growth of bacteria. On the basis of mode of action, we can classify them in five types. The first one is inhibition of cell wall synthesis. The second one is inhibition of cell membrane, inhibition of protein synthesis, inhibition of nucleic acid and antimetabolites, etc. Let's discuss all of these mode of actions in detail on this bacterial cell. The first one, cell wall synthesis inhibitors, which include beta-lactams, glycopeptides, phosphomycin, bacitracin, and alphosaphallin. Their mechanism involved inhibiting the rigid compound that is mucopeptide in nature and known as murine. These antibiotics then come in contact with bacteria and attach with bacterial cell wall as shown. And in next generation, the defect appears in the cell wall of bacteria and in result of internal pressure, lysis of bacterial cell wall occur. Those antibiotics which inhibit the cell membrane, also called cell membrane synthesis disruptors, which include lipopeptides, also inhibit the formation of murine. These are certain antibiotics which have detergent-like effect on the cell wall and cell membrane of bacteria and cause the lysis of cell membrane. Those antibiotics which inhibit the protein synthesis are certain antibiotics which inhibit protein synthesis. Bacteria come in this category have the ability to absorb amino acids but cannot use it for synthesis of protein. This protein synthesis is inhibited at 30S or 50S subunit of ribosome. These antibiotics include tetracycline, aminoglycosides, macrolides, lincosamides, amphenicol, pleuromotilins, and oxalidinones. Secondly, those antibiotics which inhibit nucleic acid, including RNA or DNA of the bacteria, include rifamycin or enzamycin. These inhibit DNA-dependent RNA polymerase or RNA synthesis. The fifth type of antibiotics, which we called as antimetabolites, these are antibiotics which are clearly are closely related metabolites and they compete with metabolites successively in cellular biochemical reactions. Those compounds may combine with the enzyme but cannot be used further, so cause inhibition of cellular activity and cell mediators. These commonly include sulfonamides or sulfa drugs. These also called as folate synthesis inhibitors. Sulfonamides inhibit the folic acid synthesis which help replication of DNA and RNA synthesis protein by inhibiting the factor PABA, commonly called para-amino-benzoic acid. Second factor is DHF, dihydrofolate, and finally tetrahydrofolate. Here you can see the mode of action of some antibiotics on the base of broad spectrum and narrow spectrum antibiotics in this table. Now stop the video and read these all antibiotics in detail carefully. Now try to remember this chart. For any question, comment below. Best of luck.